All right, guys. So today we're going to talk about chapter 16, the cardiovascular system, blood vessels, and circulation. So hopefully you already watched um, 14 and 15, the last video. So now this is just going to be a continuation and kind of an extension of that blood flow throughout the rest of the body. Um, this topic is, I feel like it's similar to like the muscles and the bones because there's a lot of memorizing structures. So again, those structures, I feel like you can spend a little bit of time on your own, just looking at the different parts of the body, and by remembering the bones and remembering the muscles, then it's going to be easier to remember these blood vessels or capillaries or veins or arteries in the different parts of the body. So I'll spend more time in other sections, and then when we get to those parts, I'll probably just skim a little bit through it because it's just recognizing where it's at and just reading a little bit of what it does, and that's about it. So let's get started. All right. Um, Blood vessel structure and function. So there's 5 types of blood vessels: the arteries, the arterioles, the capillaries, the venules, and the veins. Okay, the arteries carry blood away from the heart to the rest of the body. Um, that's what we're going to talk about first. If you remember, the veins or the superior and inferior vena cava, the veins get that deoxygenated blood or that blue blood with no oxygen into the atrium and ventricles, and then from the right side, then we got the blood that's red coming from the lungs out of through the aorta. So the arteries have the blood that's going away from the heart into the rest of the body. That's why they're red. Okay, and veins go into the heart. The walls of the arteries have 3 layers: the endothelium, the inside, the smooth muscle, which is the middle, and then it has an outer layer. Um, the structure of the middle layer gives a elastic structure and contractility, or its ability to contract. Vasoconstriction is a decrease in diameter, and vasodilation is an increase in diameter. So when you vasoconstrict, kind of the diameter, this is your diameter. Vasoconstrict, it gets smaller. When you vasodilate, it gets bigger. Okay, so it's either going to increase blood pressure or decrease blood pressure. Okay, arterioles are small arteries that deliver the blood to the capillaries. Okay, so through constriction or dilation, so from making it tighter or wider, arterioles play a big role to regulate that blood flow from the arteries into the capillaries. So they're kind of like in between, kind of regulating that blood flow to make sure it's not, it doesn't increase the blood flow or decrease. Okay? So here's a little image of the artery on the left and the vein on the right. Remember the valves that we have here, the open and close. We have the layers, the outer layer, the middle layer, and the inner layer, endothelium. Okay, endothelium is inside the lumen, basement membrane. So just a little structure of the artery and the vein, different blood vessels. Capillaries are really small blood vessels that connect the arterioles to the venules. So we got arteries, arterioles, capillaries, and then the venules. Okay, they're known as exchange vessels because they allow that exchange of nutrients between the cells and the blood. So kind of like in between that good exchange. There's also pre-capillary sphincters that will regulate that blood flow through the capillaries, and then the capillary blood pressure pushes that fluid out of the capillaries into the interstitial fluid. The blood colloid osmotic pressure pulls that fluid into, so like reabsorption and filtration, so out or into. Okay, auto regulation, ability to automatically adjust that blood flow depending what your metabolism or your body wants to do. Okay, so increase blood flow or decrease blood flow, or filtrate or reabsorb. Okay, so here's examples: the venules, the arteriole, and the capillaries in between, a little connection in between. We got smooth muscle fiber here. So remember, red is rich in oxygen, blue is deoxygenated. The capillaries are also really thin, so kind of the red blood cells go through in kind of like a single file line. Okay, so it's really not that big room to have a lot of blood pumping in. Okay, so they're really small and thin, and red blood cells. Just look at the diameter of the red blood cell itself, and then look at the diameter of that capillary. So they're pretty thin. So it's kind of like single file line going through. So it kind of regulates that blood flow in between the two. Okay, so it's not too strong. Okay, and also this is the capillary exchange. So you got our cells in here. Make sure you got exchange of waste of cells, um, of nutrients in between the capillaries and the cells themselves. Okay. Right. Blood flows from high pressure to low pressure. Okay. The greater the pressure difference, the greater the blood flow. So the contraction of the ventricles will generate a blood pressure. So the contraction will increase that pressure or generate a pressure. It's recorded in millimeters of mercury. Okay, so that's our blood pressure, what we measure. Depends on the total volume of blood in the cardiovascular system. Vascular resistance, that is like what's opposing or against this blood pressure. So there's various factors that affect that resistance to the pressure itself. So it can be the size of the vessel. So the size of it's bigger, that means there's less resistance. If it's smaller, there's more resistance. Viscosity, or how thick the blood is, proteins or plasma, things like that, and total length of the blood vessel as well will either increase or decrease the blood pressure. Okay, so those are just factors that affect blood pressure. So here's an example. This little image just shows systolic, so like contraction and relaxation. Systolic, diastolic pressure. Okay, so that's typically what we get. What's an average? 120/80. So it's just contraction and relax. So the pressure in 100 millimeters of mercury. You can see the pressure is lower over here. It's much greater in the aorta or the arteries. Blood that's coming out of the heart. And the pressure of blood that's going into the heart is much lower. Okay. The blood pressure or the blood flow is controlled by negative feedback systems. And we've seen those already in all kinds of different chapters in the book, actually, just those systems themselves, or something is happening and we need to fix it or reverse whatever is occurring, and that's a negative feedback, and to make it stop or change it. Okay. They adjust the heart rate or the rate of that pumping, the stroke volume, or how much, the resistance, and the blood volume as well. The CV center in the medulla oblongata, which we talked in the last video a little bit, regulates the heart rate and the stroke volume. It also controls neural and hormonal negative feedback systems that regulate, so those hormones that are sent out to regulate the blood pressure to specific tissues and blood flow. And then it also receives input from three main receptors, which is proprioceptors, baroreceptors, and chemoreceptors. Okay, the proprioceptors, they increase the heart rate, so they monitor those movements, and then they increase the heart rate. The baroreceptors, they regulate the pressure or the blood pressure themselves. So in the aorta, in the carotid arteries, they send impulses. So they all send impulses or signals to the CV center to make a change. It's just they're in different parts of the body. And then chemoreceptors, they monitor the levels of oxygen or CO2, and that way, remember, if there's not enough oxygen being sent through, they gotta increase that blood flow to send more oxygen to where it needs to go. Okay. CV center responds by increasing sympathetic stimulation, producing vasoconstriction, and increasing the blood pressure to make sure we send those oxygen molecules into those areas or tissues or cells. Okay, so here they are. So there's input to the cardiovascular center or the CV center from the higher brain centers, different parts of the brain. The proprioceptors that they monitor the joint movement. The baroreceptors they monitor the blood pressure, and the chemoreceptors they monitor CO2, O2 levels, and um, proton ions. Then the output, so that goes into the CV center, and then the CV center sends signals to the effectors. Remember, they're the ones that receive it to the heart by nerves, the vagus nerves, the cardiac cellular nerves, and the vasomotor nerves. So they send those signals back to the heart to decrease the heart rate, or to increase the rate or contractility, or to vasoconstrict or dilate. You can say so. So we send first those signals to the CV center, and then they're the ones that send signals through the nerves back to tell you what to do. Okay? There are different hormones that help regulate that pressure and that blood flow. There's a couple of different systems or hormone systems that are here. Renin, angiotensin, aldosterone system. Um, so that basically the kidneys secrete the enzyme renin to increase the BP. So it goes from renin to angiotensin, angiotensin to aldosterone to increase the blood pressure. We have epinephrine and norepinephrine. Remember, sympathetic stimulation. We release those hormones and increase cardiac output. Antidiuretic hormones. So those are the ones cause vasoconstriction because there's more holding of that water. Okay, so the more water there is, the more vasoconstricted the vessels become and increases the blood pressure. And then we got natriuretic peptide. It also causes vasodilation. So it's the opposite. Instead of vasoconstriction, vasodilation, and it lowers the blood pressure. So those are just four basic systems of hormone regulation of blood pressure and blood flow. So here's an example. Control condition, you got blood pressure, baroreceptors. Notice that they stretch less, which decreases the rate of nerve impulses. And you see that in the CV center, you increase the parasympathetic stimulation, increase secretion of epinephrine and norepinephrine to the heart or the blood vessels, and then you increase that blood pressure to kind of give it back to normal. Okay. Now, the blood vessels have these what they call circulatory routes that will carry the blood throughout the whole body. So it's just different routes in our body of those vessels. We have systemic circulation and pulmonary circulation. So systemic includes arteries and arterioles that carry blood containing oxygen and nutrients from the left ventricle to the systemic capillaries through the whole body, plus the veins and venules that return blood that has CO2 to the right atrium. They all branch from the aorta, and those parts of the aorta are the ascending aorta, the arch of the aorta, thoracic aorta, and the abdominal aorta. Okay. The deoxygenated blood with no oxygen returns to the heart through the systemic veins, and all those veins empty into, remember, the superior vena cava, inferior vena cava, and the coronary sinus, which empty it into the right atrium. Okay, to the right atrium, then right ventricle to the lungs, left atrium, left ventricle to the aorta. The arteries distribute blood to various parts of the body. For the most part, arteries are deep inside, and veins can be more superficial, or they can be kind of deep as well. But they can be veins are more superficial than the arteries. The pulmonary circulation, so that was the systemic circulation. The pulmonary circulation takes the deoxygenated blood from the right ventricle into the lungs, and then it re-oxygenates it, or returns that blood oxygenated from the lungs to the left atrium to the aorta. Okay, so here's a little image of those different cycles. So just if you remember from last video, we started down here in inferior vena cava or superior vena cava. Bring it in here, it goes in here, it goes to the lungs, gets that oxygen, comes back through the left atrium, left ventricle into the aorta. So then that's where it starts going. It can go up to the common carotid artery, um, or it can just go to the different parts of the body, to the trunk, um, to the hips, to the lower limbs, different areas of the body. And here we have on the left side, we have the veins. Okay, so the blood that was deoxygenated, it's already been used. Its oxygen's already been taken, and now it's going to go back through also those systems of different capillaries all throughout, back into the vena cava. Okay, just remember this little cycle from the heart. Everything else is just, I think it's kind of common sense, just thinking about the flow of blood through our body. Let me move this. So this is what I was talking about. We'll get into maybe different parts of those systems of blood flow into the body. I think the best way is to look at images and just kind of understand where they are, and they just make sense. Um, the vertebrae, common carotid right here, right on top. The arch of the aorta right here on top. The left subclavian, right beneath the clavicle. Brachiocephalic trunk, it's up here. Ascending aorta, thoracic, thorax, diaphragm. So there's just different arteries or branches of that aorta into different parts of the body. All these little branches, just different sections, and depending on the section or the bone or the muscle is what that's going to be called. The left femoral, the left deep femoral. So on the book we have just the different ones, and it tells you where it sends the blood to. So like the heart, the right and left coronary arteries from the heart. We got the right common carotid artery, right side of the head and the neck, the right upper limb, left common carotid, the left side, the head and the neck, left subclavian, the left upper limb. It's supposed to say left, not left. Bronchial arteries, bronchi of the lungs, esophageal, esophagus, intercostal, so the intercostal or the ribs, free neck arteries to the diaphragm, inferior and superior, common hepatic to the liver, the stomach, duodenum, the pancreas. So just the words themselves will tell you kind of where it's going to take that blood to. Okay. We have the brachiocephalic trunk, the right subclavian artery, axillary brachial artery, the radial, the ulnar. Okay, so different parts, carotid artery. So these images are pretty cool. I forgot to enlarge this one, but I think these just watching live pictures is super cool. The arch of the aorta, pulmonary trunk going into the lungs, coming from the lungs. It's pretty crazy, huh? Super cool. Heart right here. Brachiocephalic trunk right here, trachea, left common carotid, left subclavian right here under that clavicle. Here's our clavicle, so subclavicle. Right subclavian. Yeah. Okay. Here's a picture from the side or lateral view of the different arteries. Here's the arteries of the pelvis and the lower limbs. So again, iliac, the ischium and ilium, those areas in the hips. Pelvis femoral arteries, the femur, tibial arteries. So here's a couple images as well. Femoral arteries here on the right, the femur, femoral vein. See, it's a little darker coming up. So yeah. All right. Now we got the veins, the coronary sinus, superior vena cava, inferior vena cava. Remember, these are our main ones, the three main ones that will send blood to the heart. Okay. We got. So here's all the different veins all over the place. Right, internal jugular, pulmonary trunk, coronary sinus, right in there. Yeah, just keep a look, take a look at these. Try to memorize them, but I know it's a lot. But it's just, I feel like if you understand if you remember the bones and the muscles, you remember these as well. internal jugular, external jugular, vertebral veins. Here we got draining of all the blood that's coming over here. It's already used, oxygen use, and bringing it back. Superior vena cava and coming down to the heart. Okay. These are more superficial veins: the cephalic veins, basilic veins, median, antebrachial, and then we have some deeper veins like the radial, the ulnar. So here we have a little more superficial, cephalic, basilic in here, antebrachial, palmar. Okay, here in the hand, pelvis. All right, the hepatic portal circulation. So that's where deoxygenated blood from the veins of the GI tract and the spleen go to the hepatic portal vein of the liver. It allows the liver to extract some nutrients and detoxify substances from the blood as well. So that's pretty cool. It's close to the liver, and it allows it to kind of clean it up, those substances, so then they can go back into the heart, back through the veins up. Fetal circulation, that's just the blood flow or different blood flow of the fetus that's inside a mom. It involves exchange of materials between the fetus and the mother, the placenta. So it derives O2 and nutrients and eliminates CO2 and waste. So here's a hepatic portal vein, the splenic vein. So we're able to clean up a lot of the blood around here. Here's our liver, kind of clean it up a little bit before we send it back up to the heart, which is pretty good and pretty important. Liver, hepatic veins, inferior vena cava, and coming back to the abdominal aorta, hepatic artery, back near that. Okay. So here on the left we have the fetal circulation. On the right, circulation at birth. So it's just it's coming in through here. It's just the blood flow, oxygenated and deoxygenated, both of the blood all in here flowing through the heart, different areas. All right, the pulse is alternate expansion and recoil of an artery of each heartbeat. Okay, so we know what the pulse is. Kind of get that pulse. A normal pulse rate, 75 beats per minute. Blood pressure is the pressure exerted by the blood on the wall of an artery. And there goes systole or diastolic constriction or contraction or relaxation. The systolic blood pressure is recorded during ventricular contraction, and diastolic is recorded during relaxation. Okay, so normal blood pressure 120/80. I think there's a cool chart explaining the kind of the numbers and where you can get increased blood pressure. And there in the textbook, there's a little chart, a little table. There's different changes that affect the blood pressure or the heart rate. Aging, again, increased stiffness of the aorta, reduction in the muscle fiber size, loss of muscle fiber strength or the heart muscle, cardiac muscle strength, reduced cardiac output, decline in the heart rate, increase in the systolic pressure or the constriction pressure. Coronary artery disease is one of the biggest causes of heart disease and death of the Americans. And then we also have congestive heart failure and atherosclerosis. So that adding or the blocking of those vessels, blood vessels, because of different substances that can get in there. About 50 million Americans have hypertension or high blood pressure, which is pretty crazy. The most common disorder affecting the heart and the blood vessels is a major cause of heart failure, kidney disease, and stroke. That's crazy. A shock is when the cardiovascular system doesn't deliver enough oxygen and nutrients to meet that metabolism. An aneurysm is a thin, weakened section of the wall. Kind of this little circle that bulges outward, forming like a little balloon. So there's something that can be blocking that. Vessel defects, trauma, if those are untreated and it enlarges, and it can burst or rupture and cause this hemorrhage. It's pretty crazy. It's pretty bad. And it's pretty deadly. So severe pain, stroke, death, hemorrhage. So yeah, so that's that. This last chapter was maybe a little quicker, a little simpler, but again, just look through the different circulation systems and different areas, and focus more on the other two chapters on the blood flow itself around the heart, different parts of the heart and circulation. I'll see you in class on Tuesday. Adios.